Hello, my name is Hutton Ledingham, and today I'll be presenting my summer research project titled Agent-Based LLM Image Department Simulator. This project explores how computational simulations can help with hospitals' understanding and improve patient flow, resource allocation, and operational efficiency within emergency department environments that are often unpredictable and highly complex. Emergency departments operate under constant pressure, managing a continuous flux of patients, unpredictable case severities, and limited staff availability. Delays in triage or treatment can directly impact patient outcomes and staff workload. Our motivation for this project was to create a system that would realistically model these dynamic interactions, helping researchers and administrators test strategies before applying them in real-world settings. We use an agent-based approach to capture the human and procedural complexity that traditional models often overlook. Our project was guided by two main research questions. First, can the agent-based modeling framework effectively replicate the flow of patients and staff interactions in an emergency department environment? And second, how do factors such as staffing levels, patient arrival patterns, and triage efficiency influence system performance metrics like waiting time and throughput? We hypothesized that agent-based modeling would be better represent real-world variability by simulating individual decision-making rather than relying on averages. Our key objectives were to develop a flexible, data-driven simulator and to use it as a tool for analyzing potential improvements to emergency department operations. Agent-based modeling has become an increasingly popular technique for studying complex systems from traffic management to disease spread because it focuses on individual entities and their interactions. In a healthcare context, this means that instead of modeling patients as identical units in a queue, each patient can be represented as a unique agent with attributes like severity, arrival time, and responsiveness to treatment. Similarly, staff members are modeled with roles, workloads, and priorities. By allowing these agents to interact under realistic rules, we can observe emergent behaviors and patterns that mirror those seen in real hospitals. Our simulator models both staff and patient agents to realistically capture the workflow of an emergency department. Staff agents include the triage nurse, doctor, and bedside nurse. The triage nurse performs initial assessments and assigns patients a CTAS level based on the severity of their symptoms. The bedside nurse manages patient movement throughout the department and assists with diagnostic testing. Doctors assess patients, order and review tests, and determine whether they can be discharged or required further care. On the right, you can see a simplified flow of these medical staff actions, from triage and testing to consultation and discharge. Patient agents are designed to interact dynamically with staff agents. Each patient is assigned symptoms probabilistically and has a likelihood of leaving the ED depending on wait times. Their journey from arrival and triage through testing, consultation, and eventual discharge is controlled by a state machine, ensuring they follow realistic, rule-based behavior. The flow of patient is driven by real-world hourly arrival data, allowing the simulation to reproduce authentic patterns of crowding and delay. We are still in the experimentation phase, but analysis will focus on identifying bottlenecks within the emergency department points in the systems where patients experience the longest delays. By pinpointing these areas, we can evaluate strategies to reduce wait times and improve overall patient flow. For instance, our results may highlight how factors such as bed availability, physician assignment preferences, or triage efficiency impact patient throughput. Even small adjustments in these areas could lead to significant improvements in service delivery. In conclusion, our project aims to better understand where and why delays occur in the emergency department, and how even small operational changes can make a big difference. By analyzing factors such as bed availability, doctor assignments, and triage efficiency, we hope to identify practical ways to improve patient flow. Although our research is ongoing, the insights gained could help hospitals make data-driven decisions that enhance efficiency and, most importantly, ensure patients receive faster and higher quality care. I'd like to thank Dr. Drew, Jerry Wu, and Dr. Holodinsky for their guidance and feedback throughout this project. Thank you for watching.